welcome to the examination case demonstration. We want to use some simulators to demonstrate different examinations you can find in the exam. So, thank you. Lie down. We start with general examination. Before you examine any patient, you greet the patient, you introduce yourself, and you take permission to examine. Good day, sir. I'm Dr. Ernest. I want to examine you. Thank you. Lie down. The position for general examination is the patient lying supine in anatomic position with the palms facing upward. Patient lying supine, the legs about together. Is that clear? Now, the exposure, the patient will remove his shirt like you can see, so that you have access to the whole of the trunk. Is it clear? Is it clear?
Yes.
Okay. Now, what are the steps? We follow inspection, palpation, percussion, and auscultation. But for general examination, there is no percussion or auscultation. We only have inspection and palpation. What is the inspection part of general examination? As the candidate, you come to the right-hand side of the patient. Even if the right-hand side of the patient is attached to the wall, you excuse the examiner to enter to the right-hand side. Is it clear? Because if you examine a patient from the left-hand side, you may be vetoed completely. Is that clear? So on the right-hand side, general examination, how do we inspect? You inspect the patient from the head down to the toes. You look at the hair, you look at the face, you look at the whole of the body down to the toes. You take note of one, the average age group the patient fits into. We normally use young, middle age, and elderly. If you think the patient is less than 40, you say the patient is young. If you think the patient is between 40 and 60, you say the patient is middle age. If you think it's above 60, you say the patient is elderly. Is it clear? Now, the second thing, you make an assessment of the health status of the patient, whether he is ill-looking or is not ill-looking. And if he is ill-looking, you establish whether he is chronically ill-looking or he is acutely ill-looking. If you are not sure where he fits into, you just say he is ill-looking. In the exam, never say something you cannot defend. Never say something you are not sure about. If you even look at the patient and he doesn't look ill, just say the patient is calm and cooperating. Some examiners don't like you to say the patient is well looking. The assumption is that anybody who is in the hospital has some problem. Is it not so? So they don't like to hear that. So you just say the patient is calm and cooperating. If you observe the patient is in distress, you say, when you are making an assessment of the health status, the patient can be in respiratory distress. A patient can be in pain distress. Or a patient may not be in distress and you just say it's not in any distress. Is it clear? Then next, you observe the nutritional status, especially if the patient is wasted. You say it. Or if the patient looks normal, you may not bother to say anything about the build or the stature. Is it clear? But if he's wasted or he's obese, you say it. Then lastly, any other thing you see on the patient, like if there is a cannula, if there is a line, if there is a catheter, if there is a drain, there is a chest tube, anything you see attached to the patient, you report on your inspection. Is it clear? Is it clear? That is the inspection part of general examination. If you are doing an exam where they expect you to present, like the dentals, you will do short case. Are you listening to me? Are you listening to me? When you are presenting, you follow the order. You don't present what you did in palpation before what you did in inspection. So what you did in inspection, you will present first. Is inspection clear to everybody now? Now palpation. How do we go about palpation?